Sue is in the clinic today to discuss some rejuvenation of the face, and we've been talking about a treatment plan with Juvederm, doing a soft lift and perhaps using a little bit of Botox. She's pointed out to me that the area that bothers her the most are the under eye circles. This is what often happens in our 50s. Our skin starts to deteriorate a little bit and deflate a little bit. It also descends a little bit. We kind of get some hollow areas and a little bit of sagging. Today, with a combination of products with the Juvederm and the Botox, we're going to be doing a soft lift. What's great about that is you get some immediate results with your fillers, and you also get some relaxing of the muscles with the Botox. So you get a total face rejuvenation without any downtime. So we've cleansed her skin, and then we're going to take the numbing cream and apply to areas that we're going to treat. So while the numbing cream is on the face, before we use the Juvederm, we're going to put a little bit of Botox in her frown area just to ease the line here in her glabellar, and I'll actually give her a little bit of brow lift and a more refreshed forehead. So can you do a big frown for me, Sue? And we're just going to mark that muscle movement. And then around the eyes, we're going to just do a little bit for the crow's feet and to give the lateral brow a little lift. And we're just going to give her a little bit out here. Great. So having Botox is a fairly comfortable procedure as well. It's just a little tiny poke. Botox does take about a week to kick in, although she'll notice a little bit every day, but it's approximately a week to 10 days before she's going to notice her final results. Her brow will actually raise up and look more refreshed. The important thing after Botox is just not to touch the area, and I like clients to do lots of frowning and working those muscles for about half an hour after they've had their treatment. Next part of the soft lift for Sue is Juvederm. This procedure under the eye is amazingly comfortable as well. She's nice and numb. We've just taken the numbing cream off and washed. So a tiny little poke, and again, just look up for me and close and see. Basically, we're taking tiny little droplets of the Refine and placing it down onto the orbital rim or the bone, just to give a little bit more volume in that area. And what's wonderful about filler is it's instant. Unlike Botox, you're waiting about a week for results. With Juvederm, it's instant result. Next part of the soft lift for Sue is the Voluma. Voluma is meant definitely for cheeks and putting volume back into areas that are starting to descend and deflate. So this is the same, just a little pinch and poke. The other great thing about the Juvederm line of products is they all have lidocaine in them. So once you get a little bit in there, that actually is very comfortable because you get that numbing inside and you really don't feel anything but a tiny pinch. And we're now using some Ultra Plus, which is a Juvederm product again, and which is really nice for nasolabials and the marionette lines. So I'm just going to do a little bit here to soften the lower part of the nasolabial. Tiny little pokes again, just really very, very comfortable. So really what we want to demonstrate is just the subtleness of a soft lift, that you can get that nice refreshed look without looking overdone, a softness under the eye, a little bit higher cheekbone put back up there, and a little more softness through the nasolabials, a little more. You can see that nice lift at the edge of the mouth, so things aren't kind of dropping down as much. And if you compare from side to side, you can see that gentle rejuvenation and fullness and volume that's put back in. There you have a soft lift done, and no downtime. Away she goes, and literally in and out within an hour.